So just while he's sharing that, I'm going to just give you an overview of the No Wrong Door approach and what we've done over here in Birmingham, and then Lindsey's going to present about what they've been doing in Walsall. Thank you. So yeah, as I said, I'll be talking about the No Wrong Door approach and the network and what we did over here. Next slide, please. So the No Wrong Door was part of one of the work streams of part of Birmingham Changing Futures. One of the aims for me when I first started the role was to get 15 organisations together. And how it was developed is had multiple focus groups with various organisations, people with lived experience about what this should look like. And this then started in 2015. So we had a mixture of organisations from homelessness services, mental health, substance misuse, and offending. And it was a mix of statutory, voluntary, and private organisations. And we got everyone to sign up and do an agreement and a data sharing protocol so we could share information with each other. The way we got organisations involved is that we offered them psychological informed environments and training, which that made people want to sign up really quickly. So that was great. And then also an access to a bridging fund. And that was really useful as well. We had loads of feedback from that, how that was useful for people when they wanted to access particular services or didn't have ID and things like that. So that's how it kind of started. Next slide, please. So the approach is really focused on that. Wherever someone turns up, they should be able to get the support they need simultaneously. So wherever they turn, whichever organisation they turn to, that someone else could either give them the support they need right there and then, or refer them to another agency. And the reason for this is because what we knew so far at the beginning and why we set this up is that we knew that people didn't really know what was going on in the sector. Services weren't connected. There's lots of silo working. And so we wanted to create something where people were able to connect with each other and work together. So one of the main aims was to break down that silo working between people and organisations, and then change and improve the way people communicate to each other and in services, but also how they connect with clients as well. And additionally, we then added on a network of quality assured members. So we developed a quality standard as well. So but that came along a bit later. So as you can see, that's a few of the services that were part of the No Wrong Door network, which was part of the approach as well. Next slide, please. So one of the main things that we wanted to do is how could we get people to connect? How could we make sure that people aren't just working in silos and that they're connecting with other services? And one of the things that, well, multiple things that we did do is that we had networking events where we had people come and talk about, their services and, have all their leaflets out. This was pre-COVID, where we used to have everyone in and talking about their service and have a little stand and table. And then we'd have different workshops and training. One of a few of our successful training was our No Wrong Door approach training, where we taught senior managers and we taught managers separately, and then we done one for frontline staff. But that worked really, really well. We had really good feedback from that because it was enabled to show them, what we mean by a No Wrong Door approach, what that looks like in practice, and why the frontline staff one really worked is that they were able to connect to other frontline staff and not feel like they're the only one with that particular issue. And actually, it is something that we're all going through together. And I think that kind of helped that collaboration between the frontline staff. We also had a navigator service, which was delivered by Shelter. And that came about because we realised that actually, although we had a system of people getting referred to different organisations, after doing some research, we realised that people weren't actually getting to those organisations. So we developed a navigator service to help that engagement. And why you probably think, well, actually, the system should change. There shouldn't actually be a navigator service. Well, what this navigator service was really focused on how we can help people engage with those services, but also empowering them. So not actually just relying on the service. It's about asking them, okay, well, what bus do you need to take, how long do you think it's going to take you, and actually doing that kind of work rather than just taking someone to an appointment, actually doing that kind of work around engaging them, and so they actually feel empowered that they can make these decisions for themselves and they can get to these services. And that was really useful. But of course, as all things come to an end, so we had the sustainment program, which was a really successful program. It's still going on at the moment, but it's been really good, and actually upskilling some of those services and all the stuff that we've learned on the Navigator service, but also it was upskilling them to do multi-agency meetings and things like that. So that's been really useful. We also had a shared case management system called ICAT. And that was actually enabling people to share information between multiple organisations. We also had a quality standard, so that was something that we developed again after doing that research. And that was something that was co-produced with people with lived experience. So they gave their ideas about what they wanted to look like, and they also took part in the assessments that we did against the organisations. And lastly, we had a partnership we still have a partnership with Liaison Diversion Service, and that was for an individual to work with the people that come out of court and custody, and we support them to, to go into the agencies within an wrongdoer network as well. So these are all of the things that we kind of put in place to support people to work together and ultimately aid change. Next slide, please. So this is some of the stuff that we got back, some of the feedback. So I'm not going to read out all of it, but the main kind of theme that we came out of this is that when we ask organisations about, what's the difference that No Wrong Door has made to your service, and here's some of the things that they've kind of put down in terms of, the training. Some people found that really useful. Some people thought about co-production a bit more, and others, it just actually increased their knowledge. Because I think sometimes working in the service, when you're particularly like a service delivery manager, you are just focused on what you're doing. And sometimes you forget that what's going on, and actually other services are also going through the same thing. So I think it did kind of help that connection between them as well. Next slide, please. This was also from the frontline staff, because we did do separate things that were for frontline staff, and that linked in with the sustainment program, but also some of the workshops and training that we delivered directly for frontline staff. And here's some of the stuff that they've given to say what's made a difference to them in terms of their approach and how they work. And next slide, please. Okay, so as you can see, I've put a lot of things in here about key learning and good practice. There's loads of the stuff that I could fit in here, but this is all I could fit on the actual slide. So I'll just say, communication is really important. So if you're ever going to deliver or create a kind of network as such, my thing would be, communication, keep it simple, and also you're going to have to keep telling it all the time. So one of the things that we noticed after doing this for, several years is that I had to keep saying what it is, what we're aiming to do, what the goal is, and that kind of thing, and keep going over it again and again. So if you're ever going to do a kind of network or an approach, whatever that may be, just make sure that you'll keep communicating about it. Data sharing. So one of the things that I learned was that even though we had a data sharing protocol to share information about clients, sometimes it was really difficult to get certain staff to kind of share information, even though they signed the services signed a protocol. People get stuck in their way, so it's a bit difficult then to actually get that communication going between services. So that was something that definitely some learning in terms of the data protection, but also as we were doing it, GDPR came in the middle of that, so I think that's probably something to do with it as well. Adding value. So one of the things that's really important, that if you're going to do anything where you're developing a new approach or anything like that, is build on what is going on at the moment in your area. So if there's already a forum or anything, that build on that and connect to what's happening in the sector, rather than trying to build something new. So that's something that definitely a piece of key learning. Reflection. So one of the things that I've noticed that and recently is that Some of the managers and the team leaders really appreciated the time to reflect on their services and how they work with each other. And so where you can, if you're doing anything like this, give time for staff, even if you're not doing a network, even if you've got a team, add time for reflection. It's really, really important in terms of change and getting people to think about their practice and how they deliver things. And also connection's really important, and making sure that you offering shared spaces where people can connect. So you could be doing that with co-location, or just having other teams come to your team meeting, whatever that may be. That's really important. Another one is about encouraging curiosity in the frontline staff. So making sure that you empowering frontline staff to actually find out what's going on out there in the sector, and giving them the opportunity to speak to other services. And it sounds really simple, but there's lots of people out there that just don't do that. So really trying to give people the time to do that. Sharing knowledge. What used to happen is, because I've been doing it over a few years, there'd be like one key person, and if that key person left, then all that knowledge is gone. So it's really important to share information between organisation and between staff within your organisation, because retaining staff is quite difficult at the moment, and it's actually important that we share stuff between everyone in organisations. And also systems change. So that's a big one, and I think what I found is that a lot of people have a different idea of what systems change is, and so it's really important, if you're doing any systems change work, that you're really clear about what it is and what system you're focusing on, but also that it's something you do as a collective, because it can be very hard and very draining trying to push. So to get started in any type of that work, my advice would be push where it moves and start there and see if you can get some momentum going. Another thing, if you're doing anything collectively and you're creating a network, you're creating anything like that, a forum, a group, is just make sure you've got robust governance structures, terms of reference, all that kind of stuff. It's really, really important that everyone knows what they're doing, everyone's committed to a shared purpose, so that you all know what's happening and who's doing what. It's really important, but I think sometimes it can be forgotten, or it can be done and written, but then it just gets put to the side. But it is something that needs to be picked up and reviewed. And last, the commissioning. So one of the things that we've noticed is that there's still quite a lot of competition out there between services. And because the way services are commissioned, it actually makes it that people don't actually work together, don't trust other organisations, and can be very guarded about working together. And I think one of the key things, I think what's important for future commissioning is making sure that there's something in there that encourages services to work together effectively, and that they're not penalised for that, in terms of, okay, well, this is my service user and I've done this outcome for them. It needs to be something that encourages services to work together so they can get the outcomes for each other and not be that competitive between each other in terms of that. And that's that for the key learning. Next slide. So yeah, I just wanted to say a big thank you to everybody who took part and came to any of the meetings, came to any of this, the training, anything like that. It was just really, really key to have people involved. And yeah, I just want to say a big thanks. And the next bit is going to be Lindsey, and they're going to talk about Rethink Walsall. We're going to talk about how they've actually developed, how they're developing No Wrong Door in Walsall. So that's really important, that there's going to be someone else flying the flag around the No Wrong Door approach. Thank you.
Are you able to see the slides?
Yeah, looks good from my end.
Yeah, okay. So big thank you. It's fabulous to be here and hear about all the great work that's continued since we were part of No Wrong Door in Birmingham. So we first got a phone call from Alana, who visited us in our little office in Small Heath, and talked through about No Wrong Door, how it worked, and it was one of our ex-service users who'd actually spoken to them and put our name forward. We had a small project, Birmingham Wellness Project, with just 1.5 staff members that were working just around the Small Heath area. And it was fab to be approached. And I get asked, well, why was it important for us to be part of the network? And the only thing I can say is, what that network, it just makes sense. Everything about it makes sense. The approach, the no-run door, keeping that service user at the very core of the centre, the lived experience, the input and the involvement, it was just like music to my ears when we first met and talked through about how much input had been put in by the experts, by experience, the no silo working, the quality standards, the constant review of the services that were being delivered. It was almost like actually it's the co-design, the service users are co-designing the service, which was absolutely amazing to hear. We lost our funding for the Birmingham Wellness Project. It ended, but I still continued to wave the flag for No Wrong Door. So although we didn't have a service in Birmingham, we were still only in, we had Black Country services, so predominantly Walsall, Dudley, and then we had the Black Country helpline that we run as well. And I think the commissioners got really bored of me, actually, because every meeting I went to, any opportunity that I got to kind of wave the flag for No Wrong Door, I did, because it made sense. I couldn't understand why other organisations weren't working in this approach, in this style. I believed in it. It worked. I saw that it worked. And there's a need for this approach. The evidence is there. The partnership working. It was just very much around, why are we competing for contracts? Why are we not working together? Because it's the best kind of outcome for the individual, for the service user, you know, to get that kind of support. So, as I said, I kept banging on for a couple of years, every meeting, every opportunity I could. In Walsall, we deliver a community recovery service that is commissioned by Public Health, and the CCG part commissioned as well. And part of that contract is we deliver a Walsall Community Mental Health Partnership Forum meeting. We'd already got 40 partners around the table, and Alana came along and actually spoke to them about the No Wrong Door approach. Our Public Health Commissioner really liked the approach, and we supported the Commissioner to write a funding bid to get some money to pilot it, which is what we're doing now. So we've piloted the No Wrong Door approach. We've designed it specifically around Walsall and the needs of the people in Walsall. It's very different to Birmingham. So the Walsall approach is network of organisations working together to provide individuals with access to all of the mental health and wellbeing support that they require simultaneously. The partner organisations communicate, work to an agreed set of standards, and they aim to improve the health and wellbeing of those they support and prevent people from falling through the gaps between services. There should be no wrong door for people who access one of the partner organisations for support. By completing, again, this is something I absolutely love, telling their story once. One referral form. So all of the partners have agreed that they will accept the one referral form, and everything is captured. So again, avoiding duplication of having to tell and relive that story again. And we provide a single point of access. So we have a free phone telephone number where referrals can come through to, so self-referrals as well. And providing a quick supportive response to access the appropriate level and type of support for mental health and wellbeing in Walsall. Again, we loved the idea of the lived experience and having those community navigators, and all of the community navigators that we have got lived experience, because it just works. It's vital, and there's nothing more empowering than when you come in and you're quite vulnerable and you see someone that's been there and is now in a completely different situation. It's so empowering, it's so powerful. So all the navigators are skilled and have local knowledge, and are able to kind of talk about all the services that are locally and support them to engage in those services. So partner organisations, we've got around 17 I think that's increased this week. So we've got CGL for drug and alcohol support, Black Country Healthcare, the NHS, the Mental Health Foundation Trust are partners. So we've got a number of different, we've got the primary care element there, talking therapies are in there as well. Manor Farm Community Association, Walsall Black Sisters Collective, Blox's Community Partnership, Black Country Innovate, Health Watch, Project Me, West Midlands Police, Walsall Football Club, so the community part of the football club support us, Turning Point, another Brownells Community Partnership, Mindkind Project, Roycroft Community Hub, Frank F. Harrison Community Association, and the Recovery College, the Black Country, and ourselves. So we've got a crisis cafe, the 24/7 helpline, and the community partnership. So it was kind of, it came up of all the partners coming together. We've had challenges. Alana has been a huge support to us, talking through some of those challenges. There was, you know, frank conversations around, are you duplicating work? Are you going to capture our stats? And we had to really break down those barriers. And actually remind people that it's about the person in the centre here. It's not about who's having what stats. It's about that individual getting the right support at the right time. And we're getting there. We're in very, very early stages. So we've just finished our pilot, and now it's coming to our contract. We don't have any funding to continue this on, but we believe so much in it that we are continuing it on. So we have just one administrator now who's coordinating all of the referrals, and then we're taking everything up into our community partnership meeting, and kind of having those meetings. We are going to look for additional funding to help grow and develop it. And today has really inspired me on that, because it's amazing to see the system change that's happened, and the difference that it's made to so many people's lives as well. And so for me, the next steps are to continue fighting for No Wrong Door, not just in Walsall, but Black Country wide, and to any other kind of areas. And we're a national charity, so I talk about it all the time to other service managers, other service leads as well. I'd just like to say a huge thank you to everyone that's kind of been involved, because without you guys starting this project, without the lived experience, and hearing that today, we wouldn't be where we are today in Walsall, and trying to, you know, we're sowing that seed now and we're growing. So a huge thank you to everyone, really. Thank you so much.
Thank you so much, Lindsey, for that. And thank you very much, Alana, for coming back and sharing your expertise with us. There's lots of love and appreciation in the chat, both for Alana and for the fact that the project and the ethos has spread so far and wide, and that's excellent. Sean Mullen made a really interesting comment, and he said, absolutely brilliant stuff and wonderful to hear. This should feed into the government's Department of Health and Social Care new 10-year mental health strategy. I think that's an excellent point, and something that we need to pick up and push forward. And Sophie is really looking forward to doing the evaluation into your No Wrong Door network in Walsall. And it's really good to see Natalie Allen in the chat, who used to be director of this department and of BCFT.